doing in the future. So I'm especially interested in prenatal and fertility care because I feel like my experience, I can help other people going through what I've been through myself.
Wonderful. Thank you, Paula.
Hi, I'm Rhonda Little, and I'm here just to keep learning more about BioTouch. And I'm a massage therapist also.
Wonderful. Robin?
I'm Robin Hall. I've been part of BioTouch for almost 20 years. I'm always here learning, and my daughter's with me. She's 7 months pregnant, so. My daughter and all the kids.
Sally?
Sally Spolstra. I'm part of the practitioner staff. I'm also an ex-nurse, meaning I've retired. And came to BioTouch first because I had foot surgery that wasn't healing, and came and it really benefited me, and I began to heal and get back to work. So, hey, I've been coming ever since and telling everybody about BioTouch.
Fantastic. I forgot your name.
Hannah.
Hannah?
I'm Robin's daughter, and these are my kids. And she's pretty much been doing the BioTouch. And anytime any of us has any kind of pains or illnesses, she comes and does BioTouch on us. So I'm here because
Keeping it in the family.
Yeah.
Wonderful. Well, tonight you will discover what a vital and significant part BioTouch can play in prenatal care. Also, I want to take a moment to mention our outreach program. If you know of any group or organization that would be interested in having Paul come and give a presentation so we can fill them in on what we're doing here at the center and around the world, especially these days, please let us know, drop us an email, or give us a phone call. Also, we are on Meetup. BioTouch has a Meetup page where we keep all our workshops, oncoming workshops listed. So please feel free to sign up. That'll give you the option to leave comments or opinions about the workshops you've attended, and you could communicate with the other members. So at this point, I'm going to turn over the evening to Winona Michelet, close, from the El Rio Birth and Health Wellness Center. Winona?
Hi. So, thanks for having me. I'm actually the birth center assistant at the El Rio Birth and Women's Health Center. I've been supporting midwives for about 12 years, and so my knowledge comes from working closely with midwives, and I'm a trained doula and childbirth educator. So one of the roles I take at the birthing center is group prenatal care that we offer. It's called Centering Pregnancy, and it is one of the options that women who come to our center have for throughout their pregnancy, monitoring their wellness and fostering their empowerment with caring for themselves during their pregnancy. So one of the common calls that we get is women saying, I just took a pregnancy test, what do I do now? And they, they're not sure if it's okay to just go about living their normal lives, or do they need to come in and do something special for their prenatal care. So the first thing we always tell them is just to continue or to begin practicing being healthy. So the most important thing that we try to foster with our patients, our clients, is to follow the wellness model, to eat well, drink lots of water and healthy fluids, and then they come to us to get their questions answered and to have their health monitored throughout their pregnancy. So midwifery care is about a more egalitarian model of healthcare. They visualize pregnancy as a normal part of healthy lifetime in a woman. Midwives also do care for women throughout the lifetime with gynecological exams and well woman visits and birth control options and support for anything in gynecological care. But the majority of what we do, especially at the birth center, is pregnancy prenatal care and delivering babies. We are an out-of-hospital birthing center as well, which is pretty unique to have the opportunity to have birth in a home-like setting that is not in a medical facility. So we have 4 birth rooms where it feels very comfortable and cozy and is more like someone's home than a hospital room. We follow throughout prenatal care, prenatal visits. There's the basic standards of care. The schedule that a woman would come would be the same whether she's seeing a midwife or an OBGYN. In our practice, we also do have a doctor that works with our midwives as one of our providers. Midwives work independently, and they are fully licensed providers who can prescribe medicine and take care of a lot of pregnancy, any kind of wellness pregnancy issue, but they do manage mostly normal, not overly medicalized pregnancy. So if someone has medical issues that they would need to go see a doctor for, then they wouldn't be able to come to the midwives. Throughout pregnancy care, there are, we check mom's blood for whether she is meeting all of the requirements. We do ultrasounds, which we would send them out to have the baby measured and make sure everything is there that's supposed to be there. And let's see, the normal measuring and listening to baby happens at every appointment. So one of the most exciting things is for moms and families to hear their baby's heartbeat for the first time. So we listen to baby and make sure the baby's doing well inside mom. But like I said, it's viewed as a normal event in life, and it's really a family-centered event as well. So partners are accompanying the pregnant mom to the appointments. Lots of families come with all the siblings, and it's a really exciting and happy time for families. One of the main tenets that we try to incorporate is that education is a huge part of, we want the mom to feel empowered by her healthcare. So taking either the childbirth education classes or coming to the group prenatal care allows a lot of time for patients to get their questions answered and to learn more than you would just by going to your standard doctor's visit where you have 10 minutes with the provider, and they may ask you at the end of the visit as they're grabbing the door handle if there's any questions. And you're like, yeah, but and you feel rushed. And many of the women that come to us who have had the experience with a doctor feel like it's so much a more warm and welcoming environment when they come to the birth center and have the midwives listen to them and spend time answering questions and encouraging them to be empowered about their own health care choices. So when it comes to standard testing and lab work that is part of the prenatal care course, we are always spending lots of time explaining what the tests are for and why we recommend doing them. And if someone has reservations about doing certain tests or questions, we'll work with them, but they are in charge of their health care. So they get to make decisions about what it is that happens to them and their baby. So, but of course we have guidelines and standards that midwives follow. They're not just practicing willy-nilly. But it's really important for patients to feel that they are in charge of their bodies and their health care. So finding a provider who will listen to you and help you take responsibility for your health. Searching out if you know what kind of birth you want, making sure that the provider you're going to will support that, and that you're going to a birthing facility that will support that. And through all that, we can still foster a very healthy and holistic guidance through pregnancy. Do people have questions? I wasn't quite sure how to prepare for this talk about what kinds of things you'd like to know.
How do you encourage people, when you say a holistic practice with families, how do you encourage people, or do you encourage people to do things like a BioTouch technique where families do alternative complementary therapies with one another?
Yeah, I mean, BioTouch is something that's I've driven by and I've seen it, and I think I've been talking to people in our office about, have you heard of this BioTouch thing? So definitely complementary practices are something that we always are talking about, you know, whether it's acupuncture, chiropractic, things that help a person, like I said, take care of their own health and foster their wellness. And so definitely BioTouch would fall under that, where that's something that they can do for themselves. They can, if they're feeling discomfort, you know, pregnancy always brings with it a lot of changes in the body. So one of the main things that we're talking about early in pregnancy is nausea and back pain and a lot of fatigue and tiredness, and of course emotional changes. So I know that those are things that you guys address here with the touch that you do. So I think that if there are things that patients can find out that, oh, I don't just have to like suffer through this, but that they can feel better during their pregnancy, that is going to make them feel happier and have a better connection with their baby throughout their pregnancy too. So if you're miserable and you're sick, you might start to feel, you know, depressed and resentful, and but it is important to find ways that we can address that and make the pregnancy an enjoyable time for women. So definitely the alternative and complementary therapies are something that we're always wanting to make sure that people know about. Yeah.
I was a patient there and ended up having to kind of go with doctors, but I thought you might talk a little bit about the birth center and the fact that how families are encouraged to come to the birth center while you're birthing, and the, you know, how the setup is, because I think using BioTouch in that situation while someone's actually in labor would be really helpful too. So I don't know if you want to talk about that a little bit.
Yeah, so as I mentioned, in the birth center, we have these 4 birth rooms where the it's meant to be a very unencumbered, let birth take its course. So there isn't an epidural, there isn't a lot of medical intervention that's going to happen in that setting. So when we teach childbirth preparation, we're talking about massage and positions and ways that moms can move their body and be in tune with their body to cope with the discomfort of labor contractions. And so part of that is being supported by people that will unconditionally support you, whether it's family members, a doula, your midwife. Most women do better if they know that there's someone there with them that will support them through a difficult time. So having a modality that you can do anywhere, anytime, and you don't have to be an expert to do it. You don't have to be a professional. It's definitely something that I think could benefit a lot of people. And being someone myself that supports women in labor, but I'm not a medical person, I'm always looking for those kind of things that can allow me to offer more ways that I can support someone in labor.
You talk about wanting people, or do you have people on staff, or do you have a list of people?
Any of those alternative therapies like acupuncture or anything like that. We've had patients bring with them, like, I I know one mom had an acupuncturist come with her to a birth. It doesn't happen very often. We've had someone who had a support person that was like a myofascial release massage therapist. I'm trying to think of what else. So it's not something that through our center we're offering or that we have on staff, people that do that.
Have you thought about getting a list of referrals that you could hand to the
We do have a lot of, we have like a community resource book, and the midwives have referral, binders with lots of cards and people in the community that we're constantly working with. And if people come to us and say, here's a service that I offer and I want more people to know about it, we're pretty amicable to just, having people put their cards. We have a certain place for it that's kind of tucked away, so we have to tell patients, here's where you can look for this information. But because it gets a little tricky too with recommending a certain person and not another person, and so but yeah, it's about community and creating, giving families the opportunity to find those resources. And when we have somebody coming to us and they say, oh, I use this person for this, it's like, oh, that's great. When you hear word of mouth that worked for that person, then we can take that as that worked, so we can pass that on along to somebody. So yeah. Anybody else? Yeah.
Are there any qualifications for people that allow them to come here, or can any pregnant woman?
So there could be medical reasons that would disqualify somebody. Most healthy people who are pregnant, I haven't seen too many reasons why someone would be turned away. Throughout the course of pregnancy, there can be things that come up that make them a little high risk, and we have them consult with the OBGYN or the maternal fetal medicine specialist.
You also have the choice to birth at the hospital with your midwife if you want, or if you feel that that's a safer option.
Right.
Or if something happens during labor and you need to be transferred, they transfer you to TMC still, correct?
Right. Yeah, so the midwives have full privileges at the hospital, and if something comes up at the hospital during labor that they need, that's outside of their scope of practice, then they have a group of doctors that they're always available on call, and they can ask them to come in and help them on the case. So if a woman needed a cesarean, then the doctor would be consulted and come in and take care of that. Reasons I've seen women transferred out of our care completely are preterm birth, or if she develops very severe preeclampsia, where they just be more medicalized, and midwives are focusing on what is normal, and they know what to look for that's outside of that scope. So, okay, good. Thank you all.
Wow, thank
you
you.
so much.
Oh, thank you, Winona. That was amazing. I just was sitting here listening to you thinking, what a perfect match BioTouch is. I mean, you were actually, I almost said, my goodness, you need to be our poster child. She was just speaking a lot of the thoughts, the things that we always talk about BioTouch. So that was great.
Where was she when I needed her?
Yeah.
Oh, she wasn't born yet, I think.
Okay, well, my name's Paul,
Oh, yes, my name's Beth.
and this is not Monday Mornings with Bev and Paul.
No.
Thursday evening.
It's the fourth Thursday of the month,
Right.
And we're doing prenatal care, so thank you, Winona, again.
Oh, yeah.
And now we're going to sort of go over the BioTouch system and practice some of the points. Now, you didn't get your workbooks, no?
Right.
Yeah. So.
We need the workbooks. We're going to Winona too, so she can take one.
All right.
Thanks, Winona.
I'm trying to be helpful and I made things worse. I'm sure he does it now. That's right, I gave mine away. So I said I was trying to be helpful and then I, thank you.
Okay. So interesting what Winona talked about in relation to the symptoms, a lot of the symptoms that happen, which we'll address with a few sets of points we're going to do. Did want to share a story about the couple of experiences we've had with BioTouch. One was a woman who worked at BioTouch, Lonnie. She actually ran the center, and her daughter got pregnant, and so they would bring the daughter in. The daughter would come in every Friday at 10 a.m. and we would do BioTouch every Friday at 10 a.m. And pretty soon the baby would start kicking, right, when we would work on the mother. And so when she finally went into labor, you'll never guess what time she was. It was Friday at 10 a.m. And interestingly about, Lonnie actually worked with her daughter while she was delivering. So she would stand, she would do the greeting, and then she would be at the head, doing the head and the neck on her while she was going through the delivery. And it was an incredibly easy birth. And then Lonnie actually worked with her daughter and the children, and she stuck posters up all over the house so that those kids and other ones that came along, they all became bio babies, and it just became part of their life. So she always had posters up so the kids would know it. She would work on them at night as the grandma. So that was a neat experience to have that with. And then one other one with prenatal care was she was a 45-year-old. She was a nurse, and she got pregnant. And the doctors told her that the last 6 months of her pregnancy, she'd be bedridden, and it was a guaranteed cesarean. And she came in twice a week to get BioTouch, and never was laid out on her back, and had a very easy delivery. We actually have a testimonial somewhere. So BioTouch can be a huge benefit, to the prenatal care and postnatal and unnatal.
Right. Life.
Supernatal. So most of you have already done BioTouch, yeah? But, Bev's going to tell us why we are here doing this. Why do we still talk about BioTouch?
Oh, well, we're just starting. We're always talking about that self-awareness begins to happen over time with BioTouch. That's what's happening here too. We just keep opening up and getting more awareness and becoming aware of how important BioTouch is for all communities. I love what Winona said about the community, because that's really what we're holding. All of us are in these different parts of a community, and we're here to serve each other and help each other. So BioTouch is really coming into its own, and we just keep talking about it more and more because it can address everything. I mean, prenatal care, that's pretty awesome, really, but it's for every stage of life. It's for everybody. So tonight we're going to really be sharing with you how incredible BioTouch can be during, addressing those symptoms of pregnancy, and how, I think the most wonderful thing is the partners can work together, mom and dad to be, or mom and dads, working together with BioTouch, right? And even through the whole process of birth even, yeah.
And I really like what Winona said about it's a joyous experience, and it's nice to see that that's the way it's being presented, as a joyous experience, not some medical disease or something that you're dealing with, you know, and all you know how to do is drugs, so it's nice that BioTouch can be brought into this joyous experience, and it's really nice that Hannah brought the kids here to learn how to do it, to make it a family gathering, you know, and to make this, because they're the generations, it's the Dominics here who are going to be passing this on to the next generation. Yeah. We're going to get you in here and get you certified.
Right.
So all of you out there on the Facebook Live or however you're seeing this, you know, we hope that you're going to learn also how to do BioTouch, which is just a simple touch healing technique where we touch lightly on the skin. So reach over and touch each other real lightly on the skin. Yeah, that's the only amount of pressure that we use.
Good touch, Julie.
And so, you know, we also want to make sure that people who are tuned in, this is the first time they've learned BioTouch, why do we touch on the skin? So, has everybody seen the ball? Well, I don't think the kids have seen the ball.
Oh.
They're going to like this.
They're going to like this.
So the ball has this is why we touch on the skin. People always say, how come you don't touch off the body, what they call energy medicine, or how come you have to touch on the skin and not through the clothes? So this is a little ping pong ball that has a circuit board in the middle and 2 batteries, and then these 2 metal clips that come out of the side, right? And so if I touch the 2 clips, the ball lights up, okay? Now that's not too big of a deal. Give me the kids. Come up here. Bring the kids up here. All right. So you stand over here in front of Bev so they can see. Turn around.
Yep.
You come over here. You can. Okay. Now you all hold hands.
And old hands.
Hold hands. Now you stand over here. Now you put one finger there on that, and I'm going to put one finger here. Oh, no, don't touch me. Just touch there. There you go. And now we're going to touch hands. Give me your hand here. And the ball lights up. Now break hands. Let go. And touch again. There you go.
Yeah.
Thank you, guys.
Thank you.
Yeah. So the interesting thing about the ball, so if Bev touches there again, and I touch her on the skin, the ball goes off. But if I touch her through the clothes, or I try to do what we call energy work, but the minute I touch on the skin, the ball lights up. So that's the power of touch to us, is it's just in a simple little ping pong ball. And that's how we do BioTouch. It's always touching on the skin. It's always touching another human being. People always ask, can you do work on yourself?
Oh, yeah, that's a great question, isn't it? Well, you know, we always say, if you can reach those points and touch them, I guess that's fine. But the very definition of BioTouch, one person touching another person like me on the skin. So if you can touch those particular points, you're really not practicing BioTouch. You're just touching points. So, yeah. I just want to say one more thing that Winona mentioned that I thought was very powerful, and that is that what they do at that center is to encourage people to take responsibility and empower themselves in their own experience. That's exactly what we do and encourage with BioTouch. That's what BioTouch brings to all of us. That amazing taking responsibility and empowering ourselves to make choices in our health and, you know, improve the quality.
And if you look at the bottom of that front page is our mission and our vision. Our mission to teach BioTouch an application of the universal principle, love thy neighbor, as a means to alleviate pain and stress and support good health through all stages of life.
Oh yes, and I love our vision. It's powerful. Our vision is to encourage all people to take responsibility for their own health care, empower them to assist others, and create a community of people worldwide dedicated to service, self-awareness, and recognizing the equality of all humanity, thus forming a chain which shall go on indefinitely. Wow.
And a chain is beginning, for those who haven't heard yet. Germany, we've been getting emails from Michaela in Germany, and they're going gangbusters. I mean, we already have a woman in Switzerland trying to get certified. Michaela just taught 9 people in a practitioner training there, and I think 7 of them want to get certified. So we're having to translate the workbooks into German, and we're going to have a German gathering one day next week to talk about how to get, so it's already, and the woman in Switzerland is already, she's got all kinds of people already and a place to do it, so the chain is getting bigger and bigger.
Yeah.
So you all have a workbook. Those of you who are watching online, you can get the workbook just by becoming a member. And we have all the, if you're a member here tonight, then you can get all the workbooks on our website. This workbook's available for you as a downloadable version. And anybody online can just become a member and get all these available. So this is what we're going to go over today. So what we've taken is 4 different sets out of the entire manual. And we make these a 2-hour workshops so you can learn all the points. And we're going to practice the points too. And so we'll just have the video going to show the points. And then when we practice, we're going to say bye to all of you on live. So before we start the points, if you'll notice here in the front, talks a little about prenatal care and some of the symptoms that happen. These are all written by Deborah Schildhouse. So it's always a nice little synopsis, a lot of what Winona was talking about too. And then we'll just go to that first page there about what is BioTouch and how do we practice it.
Yeah, so Paul already mentioned in the technique of BioTouch, we use the first 2 fingers of the hands, and we are going to be touching very lightly on the skin, like a butterfly. What seems to happen is the lighter that we touch on the skin, the more stimulating and powerful the body feels it. It's just amazing. It's just, you're so in the presence of somebody else when you're doing BioTouch. So we hold each point 6 to 8 seconds. We always wash our hands before we begin a session, or at home, just working with anybody. You just want to wash your hands. And basically it's pretty simple. I mean, once you learn the sets or the points that you're going to learn, you're immediately effective. That's the beauty and really the magic of BioTouch. It's, for me, I've got to say, BioTouch is meant for every single person that wants to learn it. It's not given to anybody specifically. It's meant for all of humanity to use and to learn and to share with somebody else. So that's really our purpose here. That's what we're doing. We're trying to get this out to everyone so that they can share in their own communities, whether that's a family or friends or co-workers. And so BioTouch is very powerful for all of us when we begin to share it and use it in our own lives. And you're already capable of using BioTouch. The moment that you learn it, you're effective. There's no, you don't have to go through any levels of mastery. There's nothing, you don't have to pay, thousands and thousands of dollars. You don't have to wait for a certain amount of time to be able to be proficient enough to even use it. The moment that you learn these points tonight, the moment you touch somebody else, boom. BioTouch is already going to be effective immediately. You're going to be effective immediately.
It's interesting you talk about everybody being effective. I just read something today, it was a post, that there's, I won't say the name, but somebody is now creating a course to help healers come to their own wisdom and whatever the other word was. And it was interesting because it's now, they're using the word healers. So they're training people to be healers. And when I see that, I'm sort of excited because it's getting it into mainstream, but it also makes me a little anxious because we need to get BioTouch out there before we have this profession of people called healers, because then what happens is we take the power away from the people. We now say, well, in order to do these techniques, you need to have a certificate or a license and call yourself a healer, and then you need to do this course, then you need to have the test to show that you emanate energy, And so our goal, as Bev was saying, is really to get this to the families and to friends and to neighbors so that we're all doing healing work, not necessarily calling ourselves healers, we're just people wanting to help one another. Just had a call last week, some lady asking us how we got away with touching people. She lived in California and she going through all this license stuff and she wanted to know if it was legal here to touch people. I'm like, what? What kind of a society are we that we have to have licenses to touch one another?
We're touch phobic is what
Yeah.
we are.
So it's time to bring the reputation of touch back into society, and BioTouch is a way to do that. And so we're really excited about these classes and the online presence that we have, and to really start teaching BioTouch to people.
Oh, yeah, well, it's a gift that's already ours. It's just a matter of, that's a very good point, because we don't ever talk about being healers. We already know that the body is the inherent healer, and all we're just doing is just coming into a relationship of healing with that other person. And it begins. It's powerful, so.
Which we talk, if you'll notice on the terms, right? We call ourselves associates. And an associate, as we've written here, is the person who performs the procedures in the manual. The term as associate is used as a matter of convenience. However, the dictionary describes the role of one who is inspired to pursue this work as one often in company with another, implying intimacy or equality, and two, one having an interest in common with another. So the word associate really works quite well in doing healing work with one another. And it just sort of creates a little, because we're equal, so the circle goes around. We'll find here that as we're doing the work with people, we seem to get a benefit too. So as the kids are going to work on mom, they're going to get a benefit, and the whole cycle just starts going on and on and on. And the other thing we found, working on the child, on the mother, you think you're just working on the mother? No. The baby's getting the benefit too. So
Yeah.
it's pretty amazing.
Yeah, I know. But, it's just, like you were saying, this whole community of a relationship of healing that we all are so ready to step into, because we've been so separated from each other. It's the touch itself that can bring us back into a rapport with each other, bring us close to each other. That's really what's been missing, that we haven't touched each other. And this is the most loving, most intimate touch when you're going to learn the greeting, which is the key that unlocks it all for the body. When you do that with someone, you just find them there. They open themselves up and trust, because you're going to be touching a very sacred space, a very sacred place on their body. And it's just this loving sense just happens. So when all those words come to us, like healer, and I've got this, and I've got it clear and everything, all that does is get in the way of us just being with each other. So that's why BioTouch is so powerful. We don't go there. We don't have any of that stuff going on. We just walk in with somebody and give them that reading and do BioTouch. There's none of that other stuff happening.
So let's do it.
So let's do it.
Yeah.
All right.
So we're going to show the points to all you here and to all you online there. And thank you, Winona.
Thank you, Winona.
Thank you.
That's all right.
Okay, well, the first thing I'm going to show you is the greeting. And like Bev said, she's already told you we touch with 2 fingers, and she's told you what the butterfly touch is like. The greeting is very simple to do, and it's always performed before any session is done. It's exceptionally simple, and it's, for some reason, there's something about it that seems to make a connection between the associate and the recipient. And like Bev said, it's like the key that starts the car, and it's very, very important. And it is a very noticeable thing that you will find is quite good. So on this one, this is the only set that we're going to use one hand and one hand only. Excuse me. Again, it's going to be done with a very soft touch, and it's the only set where we're only going to do one hand. And you need to use your dominant hand. So if you're right-handed, you want to use your right hand, and if you're left-handed, you're going to be doing your left hand. If you're ambidextrous, you can do either hand. The important thing is that you use just the same hand for point 1 and point 2. The first step in the greeting is in the soft fleshy area just below the breastbone. And I'm going to hold this count for 6 to 8 seconds. And then point 2 of the greeting, I'll turn this just a little bit so you can see what I'm going to do in the back. We're going to go where the big bone is. This bone right here, I think some people call it C7, is what it's known as. And you're going to move just again with the same hand that I used in the front to go over 1 to 1.5 inches to the left of that big bone. And you're going to hold that for 6 to 8 seconds. And that's how simple the greeting is, and it's one of the most important thing you can do because that's what starts it off. Okay?
Okay. Then the next set we're going to do is metabolism. You guys getting this? All right. So metabolism is 2 steps. The first step, we're going to just work in the front of these large muscles on the neck. That's right. And we're doing matching fire. That means you're doing the same point on either side of the body. Now we're using both fingers, an index and middle finger of each hand. And so 1 and 1 is just above the collarbone in front of that large muscle. 2 and 2 is halfway up the neck in front of that large muscle. And 3 and 3 is at the top of the neck in front of that large muscle. Okay? That's step 1. Now, metabolism helps the body assimilate what it needs and gets rid of what it doesn't need. Especially, it's one of the sets of points along with the headset that's working on the hormonal system. The adrenals, the thyroid, which, as Winona said, gets a little jiggled up when you get pregnant. I guess I've never been pregnant, so I can't tell you. So I would just have to believe. All right, step 2. You'll see that little X, right? The X is on the left breast, just 1 to 1.5 inches over from the breastbone, and it's up about, if you go, here's the breastbone, you go up about 1/3 of the way, which would be where the nipples would be on a youth. And since we have a few youth here, we really know where that nipple line is. So you go up to that level and over about 1 inch to 1.5 inches, and that's that X, that's that hold point. Okay? You're going to hold there while you're going to touch points 1 through 4 on the back. Is this in the camera?
You're good.
Yeah? Okay. So I'm holding on the front, and I'm doing, here, I'll just move that.
Go that way just a little bit. There you go. Okay. We were just missing part of your head.
Oh, don't want to miss my head. So you're holding on the front, and we're going to touch 4 points on the back. And you'll see that little dotted area that goes over the spine. That's what we call the breakover. That's directly through from that greeting point. So you learned the greeting. If you go directly through, points 1 and 2 are 1 to 2 inches above that breakover. And point 1's on the left spine muscle. Point 2 is on the right spine. Did I say right?
Yeah.
Spine muscle.
Now we're on the right spine muscle. Point 3 is going to be 2 to 3 inches below the breakover. And then we add point 4 for blood sugar situations, which I guess can get a little discombobulated during pregnancy too. So you do all 4 points. Basically, you're staying below the shoulder blade and above the hips for those 4 points. And of course, the area would be different. It would be different on the little ones compared to if we were working on Winona, who had a long body. So you just got to stay below the shoulder blade and above the hips to get those 4 points. Any questions with the metabolism? Okay. So what's the next step?
Head.
Head. Well, let's go to lower ab first, and then we'll come to head. Am I doing lower ab? Then you're doing the head? All right. So the lower ab, so this one is best done while people are laying on their back, okay? And the lower ab is basically all that area inside the hips, below the navel, and above the pubic bone here. So just in that soft tissue. Now, of course, like Hannah here, it's if you can find the hips, you're lucky. There's hips in there somewhere. So you're just going to sort of work around that area, but you're going to stay below the navel area, so where the baby is in there. And so there's 3 steps to this one. The first one is you're holding the point just on the pubic bone, the top of the pubic bone there. Okay. Point 1, as it shows you in the manual, there is just below the navel. And in theory, you're pressing a little harder than we do the butterfly touch. So a little harder meaning see an indentation this time. So point 1 is there. Point 2 and 3 are low in the abdomen inside the pelvic bone. And so like for Hannah there, you'd be sort of on a side, but you're going to be low on the abdomen. And then points 4 and 5 are just inside the hip bone, but you're still below the navel, right? Okay? So the nice thing about BioTouch is we just do all the points in different ways. So now we're going to do those points again, but we're going to do that in a through fire. And so we're going to take our open palm while they're laying on their back. You're going to slide it under their back, and you're going to have those 2 fingers sort of just hanging out at their sacrum, or that flat area in the low part of their back, which will be just sort of straight through from where that hold point is. And now you're just going to do all those points again. So you're going to do a 1 just below the navel, 2 and 3 are low in the abdomen there, and then 5 and 6 are just inside the hip. Now, while your hand's under there, it's a good time, what we do, we call local work and enhancements. This is a good time to do a little work. So what we call, you could do sweeps. And this is usually when they start feeling kicks coming out. So you can just do extra work just all around that lower abdomen area. And we'll show you also how you can do sort of low back extra work without having to do the whole back. And so once you've done whatever you want while your hand's underneath there, then you bring both hands out and you do a matching fire, right? So you do X and 1, 2 and 3, and 4 and 5. And then you could do more even local work if you want. And so even if you're just playing around, right, just do the greeting and then even just do a little touching around there. You know, even if you're not doing any of the other sets, even if all you did was the greeting and then just took fingers and touched all around there. Okay? Now, other local work you can do, if there's that low back problems, you know, you're feeling like there's a strain in that area, you could just touch around that low back on either side of the spine. You might do little sweeps coming off the spine. You might touch right on the spine into the sacrum area. You might hold on the hip and sweep around the hip area. Now they wouldn't be laying on their stomach, they could be sitting, they could be on their side. And especially like during labor and stuff, you know, while they're sort of sitting there, even if all you could do is stick both your hands into there and they're on their back, and just let those two fingers rest somewhere in the back. So you don't have to, you can do this on the back too, and just get those fingers under there to hold it. You know, or, you know, just doing work wherever there seems to be stress, whether it's labor, prenatal care, or the body just seems to be stressing out a little bit. You can just do local work wherever you want. Any questions about that part of it? We're going to practice all these too. So. All right, so then there's only one other one we do, and because I'm the only bald-headed one here.
Thank you.
Let's see.
So we're going to do
Yeah.
the headset, which is really good for hormonal imbalances, for depression, any sleep, you know, issues that come up. So, you know, anything that regulates the brain during pregnancy, you know, to help any of those issues. So we're going to begin by, notice A and A. We're going to be starting, I'm going to be holding, touching on the A on the back of the head. It's right at the center of the neck, at the base of the skull. And A through the head is on the front of the forehead, in the center of the forehead, where it begins to curve back to the crown. So we're just going to be holding that for 6 to 8 seconds. So we're working through the head at this point, through fire it's called. Holding 6 to 8 seconds. That's step one. Then we're going to, you can begin on either side of the head. So we're going to find the hold point, which is an X in the manual. And that's going to be in that indentation next to that large muscle at the base of the skull. We're going to be holding on that side of the head and working with points on the opposite side of the head. So point one is you're going to locate the outside corner of the eye, and you're going to come straight up around that ridge line that runs around the head. Remember, you're going to be just holding everything 6 to 8 seconds. So that's point one. Point two, you're going to be following that ridge line. You're going to be on the ridge line above the front of the ear. Point three is on the ridge line above the back of the ear. Point four is there's a definite indentation in the skull. It's about 1/3 of the way down from the top of the ear and about 1 to 1.5 inches from the back edge of the ear. Or you can place your fingers opposite the hold point, go straight up the back of the head over that rise in the bone. You're going to land right in that little dent right there. So that's point four. And point five is opposite the hold point at the base of the skull. That becomes our new hold point, and we're going to be touching those same points on the opposite side of the head. So again, point one, at the outside corner of the eye on the ridge line. Point two, stay on that ridge line and above the front of the ear. Point three, in the back of the ear. Point four, in that indentation in the skull. And five, opposite the hold point. In the next step, we're going to be touching those same points. We're just going to do it in matching fire. So 1 and 1, above the outside corner of the eye. 2 and 2, in front of the ear, on that ridge line. 3 and 3 in back of the ear on the ridge line. 4 and 4 in those indentations. And 5 and 5 at the base of the skull. And the last step, we're going to take the open palms, not touching the hands, and we're going to lay our open palms along points 1, 2, and 3 on that ridge line. Again, holding 6 to 8 seconds. And that's the headset. Okay.
Okay, so we're going to break up into groups, and we're going to say goodbye to all of you in Never Never Land. So thank you all for showing up with us here today.
Yes, thank you very much.